Hi, welcome back. I'm Adam Rosen, an orthopedic surgeon who specializes in total knee replacement. So on today's episode, I want to share with you one of the exercises that I share with some of my patients when it comes to getting more flexion or more bending out of their knee. Now, this is an exercise that requires some strength, some upper body strength, and some good balance. So it's not an exercise that I recommend to all of my patients. This is usually my stronger patients or younger patients. And I, even when they're doing it, make sure that there's somebody there to spot them. Now, this is an exercise that you can do in a lot of different places. I'm going to demonstrate it with a set of exercise straps that I use for workouts. But you can do this anywhere that you have a strong bar. You can use a sink. If you have a good grip, you can grab onto the sink. If you have a fence nearby, you might have an area, a workout room, or maybe a dance studio where there's a bar, but you need something stable and strong that you can grab onto. And then the exercise that I'm going to show you allows you to bend down. You're not really doing a straight squat. You're actually using your arms in a straight position and using gravity to your advantage to let your body weight force the knee down and to bend it further. But you do need some arm strength to get up if you don't have the quad strength right early on in your rehab. So that's why having a spotter behind you is really important so you don't fall and so you can be helped up if you do have difficulty pulling yourself up. So let me demonstrate to you what I'm talking about. Okay, so here I'm going to show you again one of these variations. And again, for patients that are strong enough and have the strength to do this, and you should always have a spotter, you can use a railing, you can use a fence, you can use your sink, any bar or structure that is sturdy enough for you to do this squat exercise with. So if you do have straps, grab onto your straps. If you do have a fence or if you do have a sink that you're going to hold on to the sink. And again, we're not going to squat down, but you're going to have your feet underneath you and you're going to lean back, arms straight. So all the weight is in your arms. And then you're going to have gravity be your friend and you're just going to squat. Let your knee bend, let your butt drop. If your knee is tight, you might get only this far if this leg is your surgical knee. And as you drop down, you'll feel it'll be tight. The entire front will start to stretch. And as you drop down, you'll feel it stretch and stretch and stretch. And this is why you need to be strong, because we don't want you to fall and we want it to be a slow, gradual bend. As you bend, you'll feel that stretch throughout the entire knee. After you hold it for say 30 seconds, you may not have the strength to pop back up. So this is where your hands come in handy to pull yourself forward so you can stand up, or have your spotter reach you up. Once you've rested again, you may lean back again, straighten your arms, and just let your butt drop. As that butt drops, you'll start to feel it bend and stretch and stretch and stretch and stretch. Get to that point of where you feel it really stretching, hold it for 30 seconds, and then use your arms, pull yourself back up. Well, there you have it. That's my demonstration for this extra sort of advanced deep flexion bending exercise after total knee replacements. As with all of the exercises, check with your surgeon, check with your therapist, just to make sure that this is an exercise that's safe for you to do. And it's even good to do this with your therapist early on to make sure that you're doing it correctly, and that they can even teach your spotter on how to spot you from behind. But this is just another exercise that you can use to get more bend or more flexion out of your total knee while you're in the middle of your rehab. So thanks again for watching. If you haven't already checked out, you can look at some of my other videos for even more exercises to help you get the most out of your total knee replacement. And if you haven't yet subscribed, please subscribe and you'll be updated of all the future episodes when they become available. Until next time, stay safe.